Would add, in terms of Mark's comment about an independent community hospital, bravo, right on. You're doing what you should be doing. There are people all around you who would like to subsume you and turn you into a feeder. What you are doing to preserve health care for the citizens of Van Wert preserves a valuable resource, a valuable economic development resource. It's really a good thing. So I'll do some statistics because I think it might be a little bit useful for you to know. I mean, it seems like a good thing to you here to be doing this emergency room expansion, but how does that fit with what's going on in the country? I mean, I can tell you I'm part of a company now that has about 120 hospitals around the country, 11 in Indiana, and one of the first things we do when we establish a relationship with a hospital is assess and upgrade the emergency room. It's the front door to the hospital. It's what the public first sees. You have an opportunity to make that impression that will support a decision that they might make later to come and have a baby or to have a joint replaced or to receive another hospital service. And for all the reasons that have been discussed already today, it's a good thing. Let me give you some statistics, though, and what people want early in the morning, I know, is statistics, just in support, so you can feel just a little better about how you fit into the grand scheme of things. This slide shows the number of hospital beds in service in the United States, and it goes from, looks like about 2000 to 2006, and the lower bars, the sort of army green bars, are general acute care hospitals, which is what we have, and you can see that the beds are continuing to fall. That does point out one of the reasons that we need to be strong here in Van Wert, because hospitals are failing. And if you want to hit to the next slide, this shows emergency department visits and the number of emergency rooms. And if you look at what you're seeing is that the visits, which are the blue bars, over a period of 91 through 06, are rapidly rising in the United States. Visits are going up, but the number of ERs is tracking the number of hospital beds, and it's going down. So there's definitely a supply-demand mismatch. More than 80 million Americans live more than 50 miles from a major ER, trauma center type ER, but yet the utilization rate in quote rural regions is not only higher than the utilization rate of ERs in urban settings, but it's also growing. It increased it has continued to increase from 1997 through today. Another sort of interesting, sort of fun fact about the ER, and it's a sad commentary on our times, but utilization rates of the ER for non-emergency type complaints is higher. You probably have difficulty seeing this in the back, but the upper bar is the use rate, and it's about 20 per 100 for Medicaid patients. And you can see it started at 20 per 100, and actually over the period of this slide from 1997 to 2000, looks like maybe 3, the Medicaid utilization went up to about 30 per 100. And the next graph is self-pay, and it moves on down so that insured people use the ER, frankly, less than those who don't have a relationship with a doctor. And you can sort of figure that out, because if you may be more hesitant to go see Joel Nur, for example, if you don't have insurance, whereas ERs are required by law to take care of everyone. I saw in some of the materials related to your campaign that there have been some times that you have been on diversion here in Van Wert. And if you can imagine, and use some retail analogies, but if you went to Walmart and they were on diversion, you know, the next time you might go to Target. And it also is indicative that the ER staff is stressed. When the ER is so busy that you're diverting patients, that's really not a good thing. Let's hit one more slide. This is a very important, and from the standpoints of hospital, frankly, of hospital finance, I do some work on strategic planning with the boards and administrators of the 8 hospitals that make up the Lutheran Health Network, and I sometimes, with the community boards, kind of have to explain why we want to grow. because you'd say, well, we're trying to fulfill a need, but why would we have growth as just an objective? And Mark can tell you that if you don't grow, you die. We want to be able to afford the people and the technology to take care of the citizens of this area in the best possible way, and in order to do that, we need to grow the patient base, and frankly, we need to be sure that people from our county and our region aren't getting out to providers outside our region, because we need to have the patient base to be able to have the services and the equipment that we need to take care of the folks who are close to home. So it's not evil or bad to say that we want to grow Van Wert County Hospital. And a major source of admissions is the ER. And we're seeing more and more focus of that around the country. This just shows that in 1996, around the country, 36% of ER patients were admitted to the hospital. 36% of them. And that means that of your patients that are in the hospital, more than half of them came out of the ER. And that number is rising. It came up in 2006 to 50% across the country. Now, the numbers here are going to be lower. We have high numbers at Lutheran and St. Joe. We have smaller numbers in the low teens at places like DuPont and Bluffton and Dukes and Kosciuszko. But in any event, it is a big source of admissions, and it's the front door to your hospital to keep the census at levels that support the mission. Now, just in conclusion, and I don't think you need to sort of be preached to about this, but there are a number of really good reasons to do what you're doing for your community hospital. This was an interesting statistic I found sort of in researching for this. Once a minute, an ambulance is turned away from a U.S. emergency department. Once every minute. And we're aware that right here at Van Wert County, we've been on diversion several times. You've got in your literature that in 2007, there were 2,000 patients treated in the hall. And we're going to fix that with this project. It's been pointed out that with the new privacy regulations, on top of just common decency, that private triage is an important thing to have. And then finally, on top of that, separating the ambulance from the walk-in patients is really, really crucial. And I can see your architect sort of nodding his head there. They're really a different kind of patient, and they need to be cared for in a different manner. One more slide here. Now, this is an interesting comparison here. Currently, you're doing about 15,000 ER visits in 7 spaces. So if you divide that out, that gets you to 2,100 visits per space per year. And I just grabbed a couple comparisons. The third line down there is DuPont, which has 15 spaces for 22,000. That comes out to about 1,400. And DuPont is in 2009 going to do a feasibility study on expanding that ER. Lutheran does 40,000 visits in 35 spaces. That's 1,100. The patients are more critical at Lutheran than they are at DuPont or Van Wert. When you finish with this project, you'll have that number down to 1,300, which is very sustainable and should carry you through growth to 20,000 visits. So again, a wonderful thing that you've embarked upon. It's the right thing at the right time. I think that you're going to get some encouraging news here from your campaign organizers, and that should be the highlight and finale of your day. Thanks for having me here. Congratulations on a great start to your campaign, and I look forward to contributing to it and to watching it succeed.